everyone, and welcome to this week's Spark Coronavirus Roundup. While the world grapples with the challenges presented by the COVID-19 outbreak, our attention in the veterinary profession has turned to protecting our teams while at the same time still seeing patients and interacting with clients. This week, we're going to look at the role technology plays in addressing that challenge. Let's start with telemedicine. It's taken off so much in this era of social distancing that veterinary teams can access telemedicine platforms for free. Services like Televet and Elanco's Vet Now are offering their services free to veterinary clinics to help offset the impact of COVID-19. With opportunities like that, incorporating telehealth tools into practice seems like a no-brainer. But for practices who didn't employ them before COVID-19 or didn't charge for those types of services, pricing them raises a lot of questions. Patricia West, editorial director for NAVC Media, has been looking at this topic this week. Thanks for joining us, Patricia.
Thanks, Dana, for having me.
What are some of the challenges to pricing for telehealth services?
So I think there's, you can't actually say, hey, charge this for this visit, or a routine exam should be this much. And that's because there's a lot of factors impacting pricing as well. But I think there are some general recommendations and guidelines that veterinary professionals can follow. For example, it's recommended that your services, if you do a video consultation to look at a derm issue, for example, you probably are going to discount that rate compared to what you would charge for an in-clinic exam fee. And that's because you can't do the exact same things with a video consultation. I think if you do a video consultation and you decide that an in-person exam is required, another recommendation that you could follow is to credit the price of that in-person, that video consultation, and put it towards that in-person exam. I'll also think if you choose to use a vendor's platform, which is going to add to your costs of running a business, you could raise the cost of your annual exam slightly to cover the cost of that using that vendor's platform. I think if you choose to add these services to an existing wellness program, you can bump up the price of the program to cover the additional services. And lastly, I think you need to be competitive in your pricing. What can your market bear in your part of the world? And what are others practices charging for that same telehealth service?
Sure, that makes sense. I've heard a lot of practices using that telehealth consult as a credit towards an exam model. And I've been surprised to hear that a lot of clients actually seem okay with the fact that if they need an in-person exam, that the total cost is actually a bit higher, but they're still getting a discount off the exam. It seems like some of our audiences at least will tolerate that. Have you seen that as well?
I think that is true. I think that when you poll veterinarians who are already doing this, they will tell you that it impacts their bottom line in a positive way, and that clients seem to be willing to pay for it. You have to remember that today's client is trending more toward that millennial population. There are currently 80 million millennials in the United States today, and each year they spend approximately $600 billion. They are 5 times more likely to adopt technology than any other age group. And they have said in another recent survey, 60% of them support the use of telehealth options. They will definitely pay for it.
Well, that's really good news for all the veterinarians watching today. If you want to hear more, Patricia wrote a recent article for Today's Veterinary Practice. Click on the link on your screen to get those details. Thank you so much, Patricia, for joining us today. Of course, the number one reason for veterinary clinics to have incorporated telehealth options is to help their staff stay safe during the COVID-19 crisis. We talked to Mark Magazoo, Area Business Manager of St. Francis Veterinary Center of South Jersey, about some of the creative ways they're managing that process.
Normally you're dealing face to face and clients understand a little better. They feel good about the decisions they make because they can see it with their own eyes. And now we're denying them that. So we're using a couple of things. One, phones, right? We're all using more phone calls because we're calling them in their cars. Telemedicine is a big one. So telemedicine traditionally is designed for examinations and rechecks. We're using it for those things, but also to give video awareness during the visit because we can't let clients in the building. When they arrive, they hit a button on our homepage that says check in from your car. So there's no paperwork, minimizes the phone traffic and confusion. So it's a step-by-step. There's 4 steps to it. You can see I'm on step 1 and 2 and 3 and 4. And one of those steps is to use this software called WaitWhile, which can be adapted for other industries, but we know of it through restaurants to check in. And our clients can see where they are in line. Fur Baby Tracker, we're just starting with this, but it's a tremendous tool. What it does is it allows us to predefine a process. So, for example, let's say your pet is in for an emergency exam. We know that we're going to check vitals. We're going to run diagnostics. We're going to do an examination. There will be treatments. There may be recovery. There may be hospitalization. There's steps to it that we know. If you're a pet owner, you can't be with your pet, but you can see those steps ticking off in real time. You're part of the exam. So when you put it all together, nothing replaces the one-to-one, person-to-person experience of a traditional visit, but we're trying to recreate that in a way that makes the pets happy. And by 7 out of 10, because we measure this, every client gets a survey, 7 out of 10 have reported back to us, and this is over hundreds of users since we implemented it, that they not only appreciate it, but that they hope we keep some of these things after COVID.
Our conversation with Mark got a lot deeper. He shared that a member of his team was diagnosed with COVID-19 this week. Please keep St. Francis Veterinary Center in your thoughts as they battle through this. Check out their story by clicking the link on your screen. One factor that's been holding back the spread of telemedicine has been regulatory concerns around establishing a VCPR without an in-clinic appointment. Mark Cushing, the founder of the Animal Policy Group, believes that the COVID-19 crisis will have a permanent impact on this.
So the debate is only about people who don't yet have a veterinarian. And can you get started? There's no question that a lot of states and a lot of veterinarians are going to reconsider how we work with telemedicine. But I remind people you can use it right now. And I think the biggest change will be just large numbers of veterinarians that incorporate it into their practice with their current clients. I don't think we're going to go back to February 2020 status quo in veterinary medicine.
Mark makes a good case for telemedicine beyond the COVID-19 crisis. Click on the link on your screen for the full video. So there's a lot of uncertainty right now, and our next story is no exception. State and city officials are under enormous pressure to supplement the human healthcare workforce. They are asking for help from retirees, students, and others with any medical background. Of course, that included veterinarians. But these requests have been really light on details. The governor of Vermont made one such call to action, and we spoke to Dr. Emily Forbes, a veterinarian from Vermont, on her take on that request.
Say they really need people to help answer phones on Tuesday afternoons. I don't work Tuesday afternoons anyways. If I can sit on my couch and answer my phone or sit in a call center somewhere and not be exposed to people, that to me, that there's very low risk and there's a huge benefit. If you're asking me to come in Monday through Friday and you're not going to pay me, yeah, I'm going to be honest, I don't see myself doing that. So, and also the risk of I don't want to get exposed because then I wouldn't be able to work for 2 weeks, et cetera. And, I have to obviously earn my paycheck. So I think that it would just be like a weighing of a cost and benefit. And like I said, for me personally, like if it was or on a Saturdays and Sundays, if I'm not working and they need people to help answer phones, sure, that was something that I'd be happy to volunteer to do that. Like I said, I think you'd have to just really weigh the risk of what they want and also how bad is it getting? Is it just what if all the nurses and doctors are getting sick? I just think I think a lot of it's going to depend how it goes and how our responses and what they would actually need from us would I think determine who actually would be yeah, I'm going to volunteer versus right now it's all just so speculative that we just I don't have any anything substantial to actually be yeah, okay, that sounds good. I'll come help you guys or Yeah, no, I don't foresee myself like wanting to work in the hospital. So I think a lot of that would depend. But at the end of the day, I think if people are going to die and we can help prevent that, like we took an oath and I think we have to stand by that.
Wow, that last sentence from Emily was really powerful. In our conversation with Emily, she also talked about shortages of anesthesia medications and the anxiety she feels around that. I know from talking with colleagues she's not alone, so we really want to hear from you for next week's roundup. What medications have you tried to place orders for that you can't get? Where are the shortages? What are you planning to go around and work around those medications? Share your thoughts with us via spark@navc.com or by clicking the link on your screen to leave a voicemail on SpeakerPipe. In the meantime, we always want to leave on a great note, so we'll leave you with a great Stay Positive segment for the week. It's courtesy of Dr. Hunter Finn on TikTok. This is news to me. And it's definitely going to give you something to think about, whether you really want a veterinarian treating you as a human. Hey guys, that's your veterinary coronavirus roundup for this week. Cody and I just want to remind you to always keep calm and stay positive. We hope you'll join us again next week. In the meantime, stay safe. Bye, guys.